This is the frontal lobe bounded by the frontal pole anteriorly and the central sulcus posteriorly. It is divided by two horizontal sulci into three frontal gyri: superior frontal, middle frontal, and inferior frontal gyri. The inferior frontal gyrus receives the anterior and ascending rami of the lateral sulcus, and this area is the motor speech or area of Broca. It is said to be well developed on the left hemisphere. Its damage leads to motor or expressive aphasia, that's to say, inability to speak. This is the precentral gyrus, and this is the precentral sulcus. It is parallel and in front of the central sulcus and carries the motor area where the body is represented from upside down with the leg in the uppermost part, while the tongue, larynx, and lips in its lowermost part. This gyrus corresponds to the course of the anterior division of the middle meningeal artery. And in case of hemorrhage from that artery, the hematoma may compress this gyrus, leading to paralysis on the opposite side, that's to say, contralateral hemiplegia. This is the parietal lobe. Bounded by the central sulcus anteriorly and by a line passing from the parieto-occipital sulcus to the pre-occipital notch. This is the parieto-occipital sulcus, which separates the parietal lobe from the occipital lobe. The main part of this sulcus lies on the medial surface, but it cuts into the superior border of the hemisphere to appear on the superolateral surface. This is the reverse of the central sulcus, which runs most of its course on the superolateral surface, but curves on the medial surface for a short distance. The parietal lobe shows the following sulci and gyri. This is the post-central sulcus, forming the posterior boundary of the post-central gyrus, which carries the sensory area of the opposite side of the body, with the body being represented in it in an upside-down way, the same as in the pre-central gyrus. This cortical sensory area receives the sensations conveyed by the medial lemniscus, trigeminal lemniscus, and spinal lemniscus. These sensations are proprioceptors, pain, touch, and thermal. The curved gyrus around the end of the posterior ramus of the lateral sulcus is called supramarginal gyrus, while the part around the end of the superior temporal sulcus is called angular gyrus. These supramarginal and angular gyri are important centers for recognition of the structures and their meanings, a condition called stereognosis. It also contains the sensory speech area in which the meaning of spoken words can be recognized. An injury to this area leads to what is called sensory or receptive aphasia, which means inability to understand spoken or written words. This is the occipital lobe, bounded by the occipital pole posteriorly and by a line passing between the parieto-occipital sulcus and the pre-occipital notch. It shows a curved sulcus near the occipital pole called leonate sulcus. It lies at the terminal end of the calcarine sulcus. The calcarine sulcus lies mainly on the medial surface of the hemisphere. The leonate sulcus forms the limit of the visual area on the superolateral surface. The main site of the visual area is around the calcarine sulcus on the medial surface. This is the temporal lobe. It is bounded by the temporal pole, the posterior ramus of the lateral sulcus, and posteriorly by a line passing from the parieto-occipital sulcus to the pre-occipital notch. It is divided by two horizontal parallel sulci called the superior and inferior temporal sulci into three gyri called superior, middle, and inferior temporal gyri. The middle of the superior temporal gyrus carries the auditory area. This area extends deeply onto the buried gyri of the insula. Therefore, most of the auditory area is hidden by the lips of the posterior ramus of the lateral sulcus. Note also that the auditory area lies opposite the lower end of the post-central gyrus. To sum up, the sulci and the gyri on the superolateral surface, this is the central sulcus. This is the pre-central sulcus. This is the post-central sulcus. This is the pre-central motor gyrus. This is the post-central sensory gyrus. All are vertical. These are the superior, middle, and inferior frontal gyri, which are horizontal. The inferior frontal gyrus shows the anterior and ascending rami of the lateral sulcus, cutting into it. This is the posterior ramus of the lateral sulcus. This is the superior temporal sulcus. This is the inferior temporal sulcus, all running horizontally parallel to each other. This is the terminal end of the parieto-occipital sulcus. This is the leonate sulcus, which is concave towards the occipital pole.